Lumbar flattening and thoracic mobility. These two exercises are essential for spinal strengthening, spinal movement, and overall spinal health. In this video, I go over how to do each one individually, and I encourage you to review this video when you need a refresher. Throughout my videos, you will notice I will refer to lumbar flattening, or sometimes I call it pelvic tilting, and thoracic mobility. The purpose of this video is to give detailed instructions on how to do the lumbar flattening and thoracic mobility, as my exercise videos assume you're familiar with these two movements. The ability to do lumbar flattening is the critical first step to improve low back pelvis core stability. Lumbar flattening is being able to flatten the spine and press it against the floor utilizing a slight posterior pelvic tilt. Lumbar flattening is simply being able to arch the back and then flatten the back against the floor. Arch the back and flatten the back against the floor. Arch the back, flatten the back against the floor. By placing my hand under my arched back, I can then flatten my spine against my hand, cueing me to know that I am flattening the spine. As it becomes easier to flatten the spine against the hand, you can flatten your spine against your fingers, then eventually flatten your spine against the floor. An arched back has room for the hands. A flattened back does not have room for even the fingers. Good thoracic mobility is also critical for overall spinal health. I'm going to show you several ways on how to improve thoracic mobility using just the floor and some of these basic tools. This is not comprehensive, and if you find other ways to improve your thoracic mobility using these basic principles, then please do so. Here I've been laying out various types of foam rollers, from small and long ones to large, round, smaller ones, harder ones, thinner ones. Here's a pillow for the thoracic, a physio ball that you could also use. There's no specific tool to use, and you may have to experiment to discover which is best for you. Here I'm now showing you the simple way of improving thoracic mobility just laying on the floor. The simplest way to improve spinal mobility is just raising your arms overhead and holding that deep stretch for 30 to 60 seconds, with the goal of getting your hands to touch the floor above your head. Here I'm using an exercise cushion that I got at one of those dollar stores in order to exaggerate my extension just a little bit more in my spine. Note that this cushion was sold as a way to improve your abdominal muscles as an abdominal crunch cushion. And here I'm doing a slight crunch, but I'm actually raising my shoulders up in order to lean backwards to increase the mobility in my spine. Now I'm going to add a roller, which exaggerates the curve in my spine a little bit more than the cushion. Plus it also allows me to roll back and forth, helping to increase thoracic mobility as well as help with trigger points and tender points in the muscles. And then I just rest my arms overhead. Sometimes I'll hold that for 30 to 60 seconds until my hands are touching the floor. This is using a harder plastic roller that has ridges on it that is marketed to help with trigger points. Yet I do the same thing. I roll back and forth and reach my hands overhead. Now I'm going to change position and use a physio ball to try to do the same movement, but this time I'm looking down towards the ground. There is no wrong or right way to do thoracic mobility exercises using these tools. Rather, I'm trying to equip you with the principles of how to improve thoracic spine mobility. And I find doing these exercises for up to 3 minutes gives the most effective results. Here's a simple way of improving thoracic mobility using a chair. Just leaning backwards against the back of the chair. If you can keep your arms overhead, that gives a greater stretch. But if you need to keep your arms to your side, you can use your hands to push yourself backwards. Here I'm showing a rocking motion, but you can also just hold the stretch for 30 to 60 seconds and doing that for a total up to 3 minutes. Here I am again using my hands to gently push myself backwards to be able to get that full stretch. And finally, I'll show you how to use a table to increase your thoracic mobility. Keeping your hands and part of your forearms on the table, step backwards until your shoulders are approximately parallel with the table, and then gently do a simple squat and straighten back up, squat, straighten back up, as well as you can just hold that position. Please review this video as often as you need to remind yourself how to do lumbar flattening and thoracic mobility. You can also check out the individual lumbar flattening refresher and thoracic mobility refresher videos that reviews each of these movements without the narration.